الحمد لله والصلاة والسلام على رسول الله صلى الله عليه وسلم، وأشهد أن لا إله إلا الله وحده لا شريك له، وأشهد أن
السلام عليكم
ورسوله. ربنا عليك توكلنا وإليك أنبنا وإليك المصير. ربنا لا تجعلنا فتنة للذين كفروا واغفر لنا ربنا إنك أنت العزيز الحكيم. Welcome to our beloved brothers and sisters to this monthly session in which we meet with an expert from the experts that we have in our community. And Alhamdulillah, this night we are lucky to have Dr. Khan with us. Please mute yourselves. جزاكم الله خيرا. بارك الله فيكم. بارك الله فيكم. جزاكم الله خير. Please, جزاكم الله خير. We are lucky today to have Dr. Khan, بارك الله فيه, to give us some of his time and to share with us some of his experience. I will talk about this in details, but the best thing to start with, inshallah, is the recitation of some verses of the Quran. And inshallah, our reciter is Qari Suhaib al-Jibali. He will talk about some verses from Surah Al-Insan, talking about the blessings of the people of Jannah. May Allah subhanahu wa ta'ala make us all among the dwellers of Jannah. So inshallah, Suhaib will start right now, inshallah, bi'idhnillah subhanahu wa ta'ala.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إن الأبرار يشربون من كأس كان مزاجها كافورا عينا يشرب بها عباد الله يفجرونها تفجيرا يوفون بالنذر ويخافون يوما كان شره مستطيرا ويطعمون الطعام على حبه مسكينا ويتيما وأسيرا إنما نطعمكم لوجه الله لا نريد منكم جزاء ولا شكورا إنا نخاف من ربنا يوما عبوسا قمطريرا فوقاهم الله شر ذلك اليوم ولقاهم نضرة وسرورا وجزاهم بما صبروا جنة وحريرا صدق الله العظيم.
جزاكم الله خيرا صاحب. بارك الله فيكم. الحمد لله والصلاة والسلام على رسول الله صلى الله عليه وسلم. Welcome to our star today, Dr. Khan. May Allah subhanahu wa ta'ala grant him Jannatul Firdaus. Dr. Khan, I don't find enough words to describe him. He's one of the treasures of our community. He's always of a good benefit to our community. He's a psychiatrist, both for the children and adults. And by the way, he's in call. So the hospital may call him at any time, but we'll make dua, inshallah, that he will receive no call and he will focus with us. So I will just leave the mic for him, inshallah, to introduce himself, inshallah, briefly, and then we will have questions, inshallah, that I will ask on your behalf, and then we will open the discussion, inshallah. Jazakumullah khairan. So we want to know about some personal information about Dr. Khan, as well as some academic information, inshallah. Please, Dr. Khan, fadal, you are, inshallah, can talk now.
Assalamu alaikum, all brother and sister. I really thank you to the Shura of our Mikini Mosque and two wonderful Imams, Sheikh Jabali and Majid. They are doing this, our Shura is doing extraordinary work. I must say that I'm very impressed. Their goal is always the welfare of our community, and they really work hard. And especially, I will say, the Shura, and which is quite active, and this is wonderful. They asked me. I have been in medical field for more than 40 years, and I served in different specialties back home in Pakistan. When I migrated to America, then I went into psychiatry, and I do adult and child psychiatry. I worked in different capacity in different universities, hospitals, different community centers, and even in prison, jail, and juvenile jails, and private hospitals. In different capacity as mostly medical director, taking care of things. So now I have clinics, and I work in a hospital where I am on call today because I wanted my Christian doctor friends to take off and enjoy their Christmas. So we will take care of the patient. So I might get a call from the hospital. Sometimes they call me in emergency. Somebody is getting out of control. There are maybe 75, 80 patients right now, including children and adults. So this is my background. I am lucky have a wife and children, 4 grown up, and they are doing very good, mashallah, and I'm blessed in that sense. And I have grandchildren, and I enjoy their company. So this is my background. And I live in Mikini, and I'm very glad to have wonderful people like you around me.
Jazakumullah khairan, Doctor. We want to make it light for you, inshallah. So, inshallah, if the emergency call comes, inshallah, we'll be, inshallah, in the safe zone. So, yeah, Doctor, our topic today for the addiction of alcoholic drinks and drugs among the teens. So, if we have a teen at home and he's, dealing with drugs or alcoholic drinks, how to react to this. So from you, we need first to know the different types of drugs and how people used to use them to get addicted. This is the first questions. Just something very simple, because we want to know about the nature of addiction for alcoholic drinks and the different types of drugs.
Oh, wonderful. It's a very good question. And first thing is that I really thank you for doing this all. And our all effort is for the well-being of our community and of our future generation. And this is one of the big problem. And unfortunately, there are many things which we see and try to help, and many people get better. It is not something that we should consider very bad and punish the people, although it is bad. And thanks God, it was told 14 years ago, especially for alcohol and everything you all know. I'm not going to go there, but few things which were we were not sure that why the alcohol was banned and that much. But compared to ordinary people, as a doctor, we know that how much harmful these things are. Nobody knew 1400 years ago. Just for the alcohol, there is $184 billion every year that we lose because of the alcohol and related problem. Now, beside alcohol, there is marijuana, painkillers, speed, crystal, benzos, Xanax type of things. And those are also very commonly we see in school and colleges. The children get hooked up with them, and then it got a lot of trouble, a lot of problems. The consequences can be terrible, legal problem, family issues, social, school performance, job performance, financial problem. And we see a lot of people get into accidents and involve, and some people end up in being homeless because of all these crap, which Alhamdulillah, our Islam has prohibited. Now, what these drugs can do to the human being, as I was saying, just like many things in Islam, and I mentioned into my friends before that we did not know what is halal and why we have to do this halal food and everything. And when I talk to them that when you slaughter animal, the blood goes out, the nerve is not cut, so the muscles is squeezed and the blood goes out, and that meat is better. Why? Because we grow bacteria in the blood, because blood putrefy, get bad very quickly. So thanks to God, we have this halal meat. And because of, besides medical, our religious, it's a medical reason for that. And I mean, we are lucky to have that. And alcohol was banned at that time. Only we know that okay, people get intoxicated, and they can do things, and they don't know what they are doing, and that's when it started. But now I can tell you that alcohol can damage the brain. It causes dementia. It causes ataxia. It damages the brain forever if you don't treat it. It can cause throat cancer, your stomach cancer, liver cancer, liver cirrhosis, pancreatic cancer, urinary bladder cancer. And these are the only alcohol related problem. Also the nerve damages, people who have nerve damage in the feet and they cannot walk, it is always burning. So I treated a lot of patients with those conditions, but these are the chronic alcoholics mostly. But acute intoxication, another problem. Now, unfortunately, if the women are using it, they have a small liver, and then it can cause trouble. But the big trouble is that it, if she get pregnant, the child who is born, most of them have mental retardation. And that's terrible because these children have hard time. We treat them, but they hardly reach to the normal state. So there are, and then the same thing with the cocaine babies. The mothers are using cocaine and they can have the babies who have a lot of behavioral problem, learning disorder, all those things. Ordinary people doesn't know those things. So it is recommended that we should avoid, mother should be very, very careful. Even taking other medicine during pregnancy, they should always consult with the doctor. That's always good. Now, the drugs beside alcohol, marijuana, which is very common now, people are talking about marijuana, is a tetrahydrocarbon. The portion of tetra is damaging, and they are taking it out and using hydrocarbons to give people some relief, and the CBD oil and other things they're talking, but still marijuana is not good because we use marijuana in people when they have cancer and they have vomiting and it is not stopping. Sometimes they use the pills, but marijuana, definitely it is something which can cause psychosis. I treated 2 patients today who became psychotic after heavy use of marijuana, red eyes, all those things. Well, so the psychosis is they are hearing voice, they are seeing things, they feel they are on somewhere else or
Like
something.
hallucination, يا دكتور. Like
Say it again?
hallucination. They
Hallucination, like,
yeah.
yeah, they hear voices are talking to them and they look around. And this is very common in drugs like amphetamine, crystal, they cocaine, they become very psychotic sometimes and they become aggressive too, and they can hurt themselves or they can kill people.
Oh,
So this is unfortunately, we treat a lot of these patients. Then the opiate, the painkiller, it is very common. They get hooked up with the painkillers, and if they take extra dose, they can die. And every day in America, we are losing 135 people every day. One plane is falling every day. So many people are dying with the opiate. So there are treatment, there is other things. Now, the question is why people use drugs. And we know that from ancient time, these are brain kind of a altering your conscious altering medicine. What do? Is they can give you brief release, or you become numb, or you become hyper, or you feel that you have more energy, like LSD, PCP, those kind of things. But but why do you need that? And 50% of these people who are using drugs, they have mental illnesses. They have anxiety, they have depression, they can have sleep problem, and they are medicating themselves with the wrong drugs instead of going and getting treatment evaluation by the proper doctors. They can have sleep apnea problem, anger issues. Many people have that. Some children are ADHD, but they have never been tested, never been treated. And I saw many of them in the jail. Then there are some personality disorder because the home environment was bad and the child has got trauma, and then they develop some personality which can turn into antisocial personalities, which can be very harmful because these are the people who don't have any sympathy, and they can damage anybody or steal and destroy people's life. And these are the people who are mostly in the jail. So it is always good to get assessment that if there is any mood problem, anxiety problem, then once you treat them with the proper medicine, people will not go on these sides. Sometimes the companies to become cool or those peers pressure, that's why people experiment those things. And then they can hooked up with those things. Now, somebody who already is using it, so there is a 50% risk genetically if the parents are using alcohol, drugs, they can have their children who can be more prone to use those things. So it is always be careful, treat yourself, because the problem is once you start using it, you can have all those legal problem, financial problem, family, social, all those things, education, that we don't need that. We don't need for our children. So if somebody is addicted or having hard time, please contact to the proper professional people, therapy, counseling, medication treatment, help with the craving of the drugs. There are a lot of things we treat every day.
we will go to this inshallah, doctor, inshallah. But
Anytime.
I wanna because of the time, and I'm worried about any call that may come at any time. I wanna welcome Dr. Taysir Jarrah. He joined us. I wish we could have also Dr. Shuruqi with us, like this wonderful presentation and session that we had it like 2 years ago. And I remember that Dr. Khan told me something. I use it in my lectures till now. Dr. Khan, I think he's the best one to give statistics. He said to me and to the audience at the time, you know, Sheikh Mohammed, we had more than 400 mental illnesses. which, when you talk to anybody, they are afraid to tell you that they have some issues. But now we have 400 illnesses and people under, pressure in their work with their families, so they can face these things. So that's why we are, alhamdulillah, as the doctor mentally said about the mental illnesses, about the addiction, we need to call. We should not wait. As parents, we shouldn't say, oh, I don't like the community to know that I have an addicted son or daughter. You are destroying this person, because we always say prevention takes priority, over the cure. So we need to start as early as possible. This will take us to the second question now, which I think it really threatens every family, every parent attending here saying, because I mentioned it in the khutbah. By the way, doctor, my khutbah today was about this. What about caring for
Mashallah.
our kids? And that we have in our Collin County, we have kids who are addicted to drugs and alcoholic drinks. And not only that, wallahi, I swear by Allah, we have some of our teens who are drug dealers. So they are not only using the drugs in a widespread, but they are trading with others, which means that their parents are totally negligent about them. So the question now about this monster of alcoholic drinks and the drugs, if we have an addicted person in the family, how to deal with him? If he or she refused help, what would be the reaction? You are, alhamdulillah, met a lot of things like this. So what is the best solution, ya doctor? I think I'm talking on behalf of everyone that we need to learn the steps and your advice, because you are in this field.
Be kind.
What does it mean, ya doctor?
The thing is that anybody can make mistakes. It's always good to, if you find somebody is doing something which is not nice, not proper things, we can guide them, we can help them, we can listen to them. We don't have to be judge and criticize them too much. They will run away. It is not fair. If the young parents, I will say, their children are 4, 5, 6, 7, 8 year old, please, please, please be friend with them, talk to them, bring them on the dining table, listen to them, ask question, listen to them what they are saying. Once they go to age 14, then it becomes very challenging how to deal with this teenager, and they goes toward their friends mostly. So if we have a Muslim community where we can engage them, that will be great. Now, they also have influence from the other children in society, and unfortunately they can hook up with this. Now, somebody, if started and using it, and then, as I said before, that there is going to be some positional defined patient, ADHD, or some people who have, some children who develop conduct disorder and antisocial personality. They are the drug dealers. These are the people who don't have any sympathies, and they just want their money and their pleasure. So they goes to the lower level. But unfortunately, if we will be very critical, then it becomes, we are pushing them out. So be kind, bring them, ask them, we are here to help you. We are not going to judge you. Let's go and talk to somebody. First thing is first to get them evaluated. If they agree, that will be great. After 17 years, it becomes a little harder. They are independent adults. Before that, we can get them help. If somebody is really severely addicted, so we need to figure out what is the level of, is it severe, moderate, or mild? Which drugs they are using? We can treat them in outpatient clinic, and they are not going to have any problem. Then we can do counseling and can give some medication to control craving, educate them, talk to them. Second thing is that some people are more addicted. Their body got used to it now. So if they will stop, they will be having a withdrawal, bad, like painkillers and alcohol. They are addicted now. So they need inpatient hospital stay where we treat them. And they get better in 6, 7 days. Sometimes the Xanax, they also need hospitalization. So when we treat them, we taper them off from there. We control all their symptoms. We encourage them. When they become more clear, then we hook up them with some AA groups, and then they have a sponsor. And if they will slip or they will have any mistake or they can go back to drinking, then there is some support there. So we can develop some support system. But they always look, they are human beings. They love us. They are our blood. We want to protect them. We do everything we can. So my first thing is be kind, be humble, uh, just engage them and bring them to the treatment because it is very, very important. That's how we are going to save them.
May Allah rule Jannah, ya Doctor. And I want to add something, if Doctor allows me, that we need to spend time with our kids. And I remember the saying that says, we cannot sell our kids for a couple of hundreds of dollars a month when we work during the time of the weekends. So our kids should enjoy the time with us. We should watch them. We are struggling a lot because the environment outside teaching them things that they are not that are violating our culture and they are violating our deed. So we need to wake up. We need to make sure that we are with our kids all the time, that we are not busy from them because we will leave them to outside, and outside is a monster. Everybody is naming the good bad and the bad good. So we want to keep them in the safest zone. So that's why we need to pay more attention, about their friendships, about the people whom they hang out with. We really need to make sure that they are under our supervision. For sure, it doesn't mean to spy on them, because spying is haram, but at least we should know about our kids, their friends, their relations, what are they watching, how many times they spend on the social media, and to have a control over this. جزاكم الله خيرا دكتور.
One explanation I want to give a little bit. The most important thing is that we know we all came from all over the world, different countries. Our children are here now. They are going to be here. They are going to stay here. They are going to face all these things. We need to empower them. That's what you did a very good. You mentioned that we should engage our children right from the beginning. And as I told before in the masjid, and when I had the discussions, I said, ask them question and let them talk. Don't talk over them. Listen to them. Listen to them. Let's see what is their thought process. What do they know? What are they thinking? Because don't be judged and just jump. Second thing, when they have friends, go to their games, let them engage. Always invite their friends to your home. Always go and meet with their parents. That's how you will know who are the children, how are the families where your children are going and meeting. Because you have to be vigilant, but in a way that it should not be too bothersome for them. But when you are going to ask the question, a 13-year-old, what do you think about marijuana? What do you think about cocaine? What do you think about alcohol? Why it is banned? Let them talk. Let them explain you. But you should have that education and you should have that knowledge to listen to them and then engage them and ask another question, some other things, and then bring them back where you want them to be. So when their thought process, they will start thinking right, That's it. You did your job. Now you will let them swim in the swimming pool or any lake. They will survive because they know what is right, what is good and bad. I'm talking hypothetically. It is not going to be it's not going to be easy for every family, but I'm giving some points. Whoever can do that, probably it will benefit.
You are right, Doctor. Jazakallah khair. And I want to remind you something very important. Subhanallah, dua, then dua, then dua.
Yes.
Because Allah subhanahu wa ta'ala is the best protector. So
I mean-
we need to make sure that in every stage that, especially when we live here, that we include our kids in our dua. That our main goal is to make sure that our kids will be righteous. As we said in the khutbah, that this is the only benefit that we will gain from the kids. If the kids now became the wealthiest, people in the world, if they became the most knowledgeable people in the world, if they are not righteous, their dua will not reach to me in the grave. So now I didn't do anything. We need them to be a source of increasing our credit of righteous deeds. This will only happen when they are righteous. Now, inshallah, I asked my question. We will have like
Any
10
brother and
minutes.
sister, anybody has any question, please
Yes,
feel
no, this is,
free.
yeah, but we need
I will try.
to adjust it, inshallah, bismillah. If we have, alhamdulillah, people who have concerns, who have questions, please, inshallah, briefly ask your question, and also the doctor will briefly answer, because we need to, inshallah, have more questions. Inshallah, we have like 15 minutes. So if you have comments as well, you are more than welcome, but just make it as brief as you can, inshallah, bismillah. So we'll listen to, I will leave it, inshallah, open now. So please, inshallah, if anybody has a question, please, inshallah, go ahead. 3, 2, 1. Okay, so this is a question here. If a person has addictions, how should they tell their spouses and kids? Doctor.
Spouse is the most reliable person. And when we are married, we love each other. This is the most closest relation anybody can have. And some people have the addiction problem. If they want to tell their spouse that I have this problem, is it not to get approval that it's okay, now you know that I'm drinking, so I will keep drinking? No. The purpose, if it is that I'm telling you because I'm helpless, I want to quit, I could not, I need your help. That's the best way. And they should open up. They need to know why it is bad. First thing is first, always, that why I want to quit. What is the wrong with this? If you realize that, yes, this is the problem, I'm having my family and financial and job, I have this medical issues, I have start developing some medical heart attack or blood pressure problem or impotency with alcohol. You cannot, some people are unable to have children. Those drugs can affect that too. So if anything is there, first thing is to realize it. Second thing is get help and talk to a spouse. If you are afraid that you cannot and it is going to be a backlash, then use a therapist and open up and talk, and the therapist can bring your spouse and they will discuss, and then it's going to be smoothly driven away, and then you can have a treatment plan.
Jazakallah khair, Doctor. Everybody wants a question and does like to talk, you can chat like the brother who typed it. But I'm going to ask the doctor the other side of the story. If now the wife knows that her husband is addicted to alcoholic drinks or drugs, between the husband and wife, what shall we do briefly, Doctor? If it is the other way, if the wife knows, for example, or the husband knows that the wife is addicted, or the husband knows that the wife knows that the husband is addicted, how does she deal with this, with this action?
Yeah. So again, the thing is that this is the biggest trust really trusty relation you have. And Alhamdulillah, in most of our marriages, once you are married, you are married. So it's okay to talk to the person that I know you are smoking, or I know that you are. I saw some drinks. Do you drink? Do you use these things? You don't have to get upset. You don't have to get angry. We need to know, and we can go and see Dr. Khan or Dr.
So, you
XYZ.
mean, Doctor, you approach and you shouldn't keep it hidden. You approach in a nice way, in a
Yeah,
way that you
yeah,
show
yeah.
your love to the spouse, and
Yes.
also finding a treatment, not just to blame.
Yeah.
Right, yeah, Doctor?
Yes, always be very respectable, because the respect give you a lot. Uh, Now, there are there is a question that female psychologist from the in our yes, we have some female psychologists in Muslim community, and we can provide their name and their telephone number. One question was that they don't listen, the children don't listen, and they're still selling it. They are really in danger. Things got too far. The measure should have been taken a long time before, but now it's going to be a big trouble these children can be. So if they're not listening, they are defined a positional and become now turning antisocial. Now this is a really worrying time that we should do everything to help them. So now, sister, if that is the case, involve our imams, and we will try a different way to handle that children. It's okay if they are doing it, because before they get caught by the police and put on probation, and then they will violate probation, they will end up into big troubles. And so it is better to get our help, our community leaders' help, before it go beyond out of control.
Jazakallah khairan, Doctor. Any questions that are written through the chat, or someone wants to verbally talk to the
Are we recording it, Imam? Are we
Yes,
recording this
yes,
program?
yes, I'm recording it just and I will send it only to our group for the people who are attending and the people who want to watch our programs, inshallah.
Thank you so much. Thank you so much.
And again, I wanna tell something also concerning Dr. Khan. Dr. Khan has given us his time. There is no liability for whatever he's saying. We are not talking to him now as a doctor that is responsible for what he's saying. We are listening to his advice. So please, inshallah, Dr. Khan has, alhamdulillah, an experience in this field for 40 years. So what he's saying now is an advice. This is what we are telling the community, and this is our program about the experience that we gained from our treasures. So it's like a big family, and we are learning from the experience. So it's not a medical prescription or anything. So this is just to make it clear, inshallah. I'm talking on behalf of Dr.
It's not a consultation.
No,
It's
it's
not a
not a
consultation.
consultation. It's an advice,
Yeah.
an advice from a beloved brother who had experience that we do not have, and he will, inshallah, and he did already, alhamdulillah, give us a lot of valuable advices. May Allah subhanahu wa ta'ala add this to his credit. And inshallah, the next time, inshallah, or the one after the next time, we want to, inshallah, host Dr. Jarrah and Dr. Shuruqi, inshallah. Both of them can benefit the community. But alhamdulillah, now we are, alhamdulillah, gaining barakah and the blessing and the honor to be with Dr. Khan. And we still, inshallah, need a couple of questions, inshallah, to end with. We still have like 4 or 5 minutes. Dr. Sheikh Majid, do you have anything to say? Imam Majid.
Assalamu alaikum wa rahmatullahi wa barakatuh. It was very successful project. We thank Dr. Khan for that, and we do appreciate your effort, Dr. Sheikh Jigibali, for that. And we thank all the attendants, Jazakumullahu khairan, and please pass the message and pass the advice. In the meantime, a special thank to Dr. Khan. I'm not going to give him a compliment, but he's the doctor of my son, and wallahi is my witness nobody was able to put my son back in track the way that Dr. Khan said, and the way Dr. Khan advised and helped. I'm not giving him any promotion because he's not paying me anything, you know. Besides dua, inshallah, we should pay him dua, inshallah. Thank you very much, Dr. Khan. Thank you very much again. And no matter how much thank we give you is not enough, but we give the opportunity to Allah to grant you the thanks, inshallah.
Jazakallah khair.
May Allah make it sadaqah jariyah for him.
Ameen.
And may I just say, Imam, that my daughter and my son-in-law just drop in before the program started, and they listened it well. So inshallah, they will benefit. It was
No,
just
but
I wanted
a
to make
surprise visit.
I wanted to make it very successful, so my khutbah was about this topic, just to let it go in line with this. We wanna hear from our beloved Dr. Jarrah. Dr. Taysir Jarrah is with us. Please, Dr. Jarrah, we like to listen to you. So if you can, inshallah, say something, very, very thankful.
no
Alaikum
one can
salam.
reward you, Dr. Khan, as much as Allah will reward you. We keep it in between the hands of Allah to reward you.
Dr. Jarrah.
Jazakallah khair.
Dr. Jarrah, تفضل, we end with the words of Dr. Jarrah, inshallah.
Alaikum salam. Dr. Khan did a wonderful talk as expected, mashallah. I want to make a short comment. Look at how Islam treated Arabia when they were indulged in addiction, alcoholism. Now, let me sidetrack 2 minutes. When they say, إنما الأمم الأخلاق إن ذهبت أخلاقهم ذهبوا. Look at what happened to the Indian nation. The Indians in this country, they flourished. Of course, they were attacked and everything. But what really devastated them is alcohol, addiction, disease. Now the people from the West, of course, it's a trade, make money. Turns out there are subsets of genes. Now the Indians have the worst subset of genes. They don't have the enzyme that defends the body against alcohol. So, and there are people that can guzzle gallons of alcohol. And supposedly, as far as physical illness, disease, liver, they can consume gallons. Those subsets are some of the Jewish tribes. The Indians, they lack the enzyme that breaks down alcohol. So they develop tuberculosis, disease, social issues, family issues. It devastated families. Not only that, instead of making it through da'wah to the Indians, it was prohibited. Their counties, you could not do gambling way back then. So they made them in on reservations. Gambling, drinking, it wiped them out. Look in Texas, Oklahoma, and so forth. You don't see the civilization in God. Truly, if the world, America, Europe, they truly need the da'wah of Islam. Look at what's happening in our country. Now, in Palestine, Holy Land, the Orthodox Jews refused to have the casinos built in traditional Palestine. They allowed it to be built in Jericho. It's called the Badlands. They don't want it. So those who are addicted to it, can go there. Alcohol, casinos, you name it, you make money. You will realize what I'm alluding to. Those among the Hebrews that want to do that, they still do that. And our own people who are vulnerable do that. Because da'wah is weak, iman is weak, the true ilm is missing. And as Dr. Khan said, you can get back to it بالتدرج, بالتعلم. But you have to have the combination, and you have to have the right guidance. You have to have the right iman, kun ma'allah. You have to have the right science. But these problems are really a problem. America, the Indian nation, the world, the Arab countries, they need Islam. They need Allah. And there goes the science and the right tools, the right approach. Jazakallah khair, Dr.
Barakallah fikum, Dr. Barakallah fikum. Dr. Atiq, we want to hear from you. And inshallah, bismillah, because whatever words we say, they are not just, fulfilling our gratitude to Dr. Khan. So our Amir should talk, inshallah, and should deliver a message on behalf of the people.
Jazakumullah
message
khairan.
after he's done too.
Jazakumullah khairan, Imam Jabali and Dr. Khan. Most grateful. I wanted to ask one question before, Dr. Khan leaves. I want to know what percentage of the influence does the outside world has as compared to the influence from the family. This is part one of the question. Second is that if the parents do not know how to deal with the outside influence, what guideline do you think the parents should get? Because the problem is when there is a conflict between outside values versus the inside of the home values. This is what I've seen it in the college. This is what I've seen it in schools, and I also have taught in jail, and this is what I observed in all those criminals who came over there, the conflict between the home value versus the outside value. Kindly comment on that.
Well, it's a very good question. I think we need to set a couple of more meetings. I want to thank you, Dr. Jarar. We are blessed to have him. He's one of the most wonderful person, and we are very lucky to have him too. And Dr. Atiq, you are awesome. You always very positive and looking forward, and this is going very well. The question is two things I will tell first. One is that there is a hope. All the people who are drug addict to any drugs, there is a treatment. Anybody can get sober and we don't need to use any drugs. Simple. And the best thing is that I tell you there is a hope. There is full treatment of all these drug addictions and full recovery. Good thing is liver regrow. Brain does not regrow that much. We have the knowledge. Now, before it gets too damaged, you need to stop because the doctor will stop ultimately. So one thing is that. Second thing is Dr. Atiq's question is very interesting and very commonly I hear this, that what we should do, because we are from different culture. We came here, we are grown up, we were in an environment, all those environment, everybody was looking for us and we grow up in that. Here, they don't have that. They spend 8 hours, 9 hours in the school. where they have all the exposure of the world. This is what is challenge for us, because at home, we give them references of us, how we were with our parents and how they were respectable. Here in school, they said, look into the eyes. So there is the child get confused who he should follow. So we should have a middle, some place where we can meet with them. That's why coming into this country, we enjoy a lot of things, but there are challenges. So influence from outside is, I will say, 70%. Because you spend only 4 hours with your child. They spend 8 hours in school or with the friends. So you have 1/3, and their outside influences 2/3. Now, how you are going to use the best 4 hours? That's where we need to talk and find out, and we need to engage them. They should count you as a friend. The daughters should count mothers, the friend. The boys should count the father as a friend too. And be open. Don't be too rigid. Don't be too hard. Give them space. Let them open up and talk. Meet with their friends and listen. It is a long process. I was talking to Imam Javadi, the wonderful person. I said that a lot of people come to us and ask the young parents. They have young children and they are very busy. I mean, the families are busy. Mom is working, father is working, coming, they have free time, little bit. The children are shouting or running around there. They open the cartoon and then they say, okay, go and watch that and let us. What is important is that I talked about the Omar and Hana. That's one series, our Indonesian Muslim brothers and they step. If you go on YouTube, watch that Omar and Hana. It's a very good, very, very informative. You want to structure the children in early age in first 7 years. Once you structure that nicely, and that I found very interesting, very helpful. So please, I will recommend everybody to Google on Yahoo, check Omar and Hana. If you think it is going to be beneficial for any Muslim youngsters, it is good because it will make it is going to build the foundation. When they will grow a little more, then we can engage them in the masjid and other things. And that's when you can neutralize that foreign outside influence or turn it in a positive way that involve them in a lot of sports, exercises, do those things. So they should not go and they should be aware of their health. So that's another tool, involving in Islamic activities, prayer and Fajr time, how it is good, beneficial. A lot of things we can do, encourage them. So my imams, they have the mic and the Fridays and other things. They are very powerful people. So I always request that we can use that very nicely and it is going to be very beneficial. So I think this is a long kind of a struggle, but when we will make some groups, youngsters, probably in future, they can take over because this foreign influence is going to be there. There's gay, there is this is drug, all those, they are listening, they are talking, they are not talking in front of you because they have two-faced. So you need to engage them.
Jazakallah khair, Doctor. We will wrap up, inshallah. And I want to thank Dr. Khan for his time, Dr. Jawad, Dr. Atiq, everybody attended, Imam Majid. I want to end with
Just, I don't have a question. I have a couple people would greet you over here. They are, you are lovely. You have lovely visitors over here. They want to greet you. Come on, brother. Brother,
يلا أمورنا about صلاة العشاء إمام ماجد. It's almost
Come on,
3
brother.
minutes. Yeah.
We have two guests over here. They would like to greet you, and you love them. I know that, and you remember them very well.
Show us the guesses إمام ماجد.
Assalamualaikum warahmatullah.
وعليكم
Buddy, how are you?
السلام.
Alhamdulillah.
Nice to see you all.
You're doing good. Yes, please. Yes, we will meet, inshallah. Inshallah. Inshallah.
Inshallah, we want to
Inshallah. Wa alaykum salam. Good, good. Very nice to see you.
Inshallah.
Stay happy and healthy. Inshallah.
At the last flavor of the meeting, to see that our lovely Qari over here. جزاكم الله خير.
Mashallah.
بارك الله
جزاكم الله خيرا.
جزاكم الله خيرا. We alhamdulillah end with all the thanks and gratitude to our beloved brother Dr. Muhammad Khan. جزاكم الله خيرا. May Allah accept from you. اللهم يا الله يا منان يا ذا الجلال والإكرام نسألك بأنك أنت الله الواحد
There's a time, can I ask a question?
ولم يكن له كفوا أحد. اللهم صل على نبينا محمد وعلى آله وأصحابه أجمعين. اللهم تقبل منا أجمعين. والله accept from all of us. والله سبحانه وتعالى add to
Time, I have a question. If you-
يا رب العالمين. والله added to the credit of your servant Muhammad Khan يا رب العالمين. Give him barakah in his health, in his wealth, in his wife, in his kids. Make them among the righteous ones. O Allah, gather us under your shade in the day of judgment. O Allah, free all of us from our from any sickness and from any bad behavior. O Allah, reform the condition of our teens, Ya Rabb al-Alameen. Make them among the righteous ones. Make them among the righteous ones. Make them ambassador for the deen of Islam. O Allah, accept our deeds. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. Sorry, يا إخوان, I'm so sorry that some of you have questions, but we need to end now because Salatul Isha, inshallah, will be inshallah now at 8 o'clock, inshallah. Jazakumullah khairan. May Allah accept from all of us. Barakallah fikum, Dr. Khan. Barakallah fikum, everyone. Jazakumullah khairan. Subhanakallah.
Muhammad Siddiqui Saab, you can call me or you can talk to me and you can ask your question. I will be glad to answer that. Don't worry.
Do you have an access, Dr. Brother Siddiq to Dr. Khan?
Yeah, just yeah.
I have a small question, so that's why.
Because of the time. Right. Okay, we can receive this question, inshallah.
Yeah.
Inshallah.
Yeah.
Sheikh
Inshallah.
Majid, you can look out for Salatul Isha, but you can ask your question, Brother Siddiq, so people will get benefit of it.
Thank you. Jazakallah.
تفضل Brother Siddiqi. تفضل Brother Siddiqi.
Assalamu alaikum.
تفضل Brother Siddiqi. Say your question, inshallah.
Okay. Yeah, the question is, because since we came here, we have all the parents, they have a problem. The problem is the curriculum in the high school is the way they teach. They said to the student, and I read some of their books, it says what you want, you have to do it. Suppose you want to become musician, become musician. If you want to play singing a star. But parents, all the parents, particularly from India, Pakistan, and that place, they wanted to have their kids as a doctor, engineer, like that. So how we can take out that thing from the mind of the kids who learn that, you know, they can do whatever they want. They do, that means they don't have to listen to the parent. That's what their curriculum book says. I read some of the books.
Yes, Muhammad Siddiqui, this is the one thing which we were talking, and I think I need to set a time to discuss about all these things because this is the child development and adolescence and the cultural things and how to deal with that. I think it's a big topic, and one of this question is very important. I will explain to you more.
Inshallah. This is now we gain a promise from you that we'll meet again, inshallah. Within a couple of months, inshallah, we'll get back to you with this specific topic, inshallah. So you will answer, brother.
I suffered, and
Inshallah.
now I'm got through. But
Thank you.
for the
Jazakumullah khair. Inshallah, if you want
Parents,
to watch this halaqa, I'm gonna send it to WhatsApp group, inshallah. Again, Jazakumullah khair, Dr. Khan.
Inshallah.
We got benefit from it, and Jazakumullah khair, everybody here. Barakallah fikum.
Thank you.
Subhanakallah.
Fi aman.
Nashad-
Assalamu alaikum.
Jazakumullah khair, everyone. Salam alaikum.
Shukran, brother.
Barakallah fikum. Salam alaikum.